So you might have heard of hantaviruses, perhaps most recently from the news, where they're covering an outbreak involving a cruise ship that left Argentina just a couple of months ago, so in April of this year. Unfortunately, one of the passengers got pretty sick, and just 11 days after the ship left port, he died. And then his wife, who was traveling with him, also came down with symptoms and then died just 2 weeks after that. Further investigation was done, and it was found that these patients had likely contracted hantavirus, specifically a species known as Andes virus. Andes virus is known to occur in South America in countries like Argentina and Chile. My name is Reeti, and I'm the Infectious Disease Laboratory Director at National Jewish Health. So Andes virus is one of the species that can cause hantavirus cardiopulmonary syndrome, also known as hantavirus pulmonary syndrome. And it starts off with just really general viral symptoms, things that we all get, like high fever, headaches, intense fatigue, maybe some dizziness. And sometimes some patients can see some gastrointestinal symptoms, so like nausea, vomiting, diarrhea. The problem is this virus has this long incubation period, anywhere from 1 to 6 weeks. And so it can be really difficult to connect those symptoms with an exposure. But a hallmark feature of hantavirus pulmonary syndrome is that patients start to get very short of breath. They often start coughing, and then because of that lack of oxygen, their fingertips or lips might turn bluish. And then what makes these cases a real challenge, and it's sticky in the news, is that these symptoms can get serious fast. So their lungs can fill up with fluid. In some cases, the blood vessels get leaky, so they can get nosebleeds. Their blood pressure will drop, and the patient can die in just 4 to 5 days after that, those initial symptoms. So Andes virus is present in South America, but we have hantaviruses in North America too. You might have seen the news just last year where businesswoman Betsy Arakawa, who's married to Gene Hackman, contracted a hantavirus and died. And she lived in New Mexico. That's important. This is actually a picture of my family. We just recently visited the Four Corners Monument, right? So we're standing simultaneously on New Mexico, Colorado, Utah, and Arizona. And that, in fact, is the region for the Four Corners outbreak of hantavirus in the 1990s. And at that time, no one really knew what was causing people's symptoms, but the first 2 victims were another couple, that time young, healthy. The hantavirus species present in America is called the sin nombre virus, and we now know that it's endemic to those 4 corner states, but it is, as well as that, much of the western U.S. as well as parts of Canada. So in the Americas, we know there are several hantavirus species that can cause this cardiopulmonary syndrome. And unfortunately, the fatality rate of this disease is quite high, between 30 and 40%. It can be higher than that if the virus is not recognized in people that are elderly, if they have comorbidities. It can be lower than that in people that have adequate treatment. There are hantavirus species in Asia and Europe as well. These species manifest slightly differently. They manifest as hemorrhagic fever with renal syndrome, or HFRS. Fortunately, the fatality rate of HFRS is slightly lower, between 1 and 15%, depending on which virus species is causing the infection. We've actually known about HFRS for a long time, since the 1950s, when more than 3,000 US soldiers contracted the disease during the Korean War. It's actually covered in MASH, if you've ever seen that show. Similarly to the pulmonary version, it starts off with just generic symptoms. We got that high fever, intense fatigue, headaches. Sometimes in severe cases, you might get that bleeding from skin and gums. But in this case, the issue is mostly with the kidneys. The kidneys shut down, patients stop producing urine, you might get generalized edema from all of that fluid buildup, and their blood pressure drops, you might get more serious outcomes. We now know that HFRS is caused by hantaviruses, and there are at least 2 species present on the Korean Peninsula. One of them is the Hantan virus. That tends to be a little bit more common, especially in the rural agricultural areas, and it tends to be a little bit more severe compared to the Seoul virus, which tends to occur in more urban environments. So how are people getting hantavirus? The answer is rodents. And different species of rodents are carrying different species of hantavirus. For example, in Asia, the Hantan virus is carried by the striped field mouse, but right in the same region, Sol virus is carried by a different vector, the Norway rat. And then we have in Russia and Europe, the Pumala virus is carried by the bank voles. And in years when the bank vole populations go up, we get more cases of human hantavirus, especially in countries like Finland and Germany. In North America, the Sinombre virus is carried by the deer mouse, and in South America, the Andes virus is carried by the long-tailed pygmy rice rat. So rodent-borne viruses sometimes get a fun name, roboviruses. Basically, rodents will shed the virus in their secretions, so like saliva, urine, feces, and then humans can acquire the virus through exposure with these secretions. So they might inhale virus particles, they might ingest unintentionally contaminated food and water. You might get it from direct contact with mouse droppings or with nesting material. And in some cases, rare cases, you can get it directly from rodent bites. We don't know yet exactly what the route of exposure was in this most recent outbreak, but we do know that the index patient went bird watching when he was on shore in Argentina, and that's likely where he contracted it. But as of now, there have been multiple passengers on the cruise ship that have come down with hantavirus symptoms. One woman did not go bird watching, did not have the same exposures as that index patient, but she actually got sick and died about 3 to 4 weeks after that initial case. So the timeline is a little bit off. Is it possible that she got exposed somewhere on shore? It is certainly possible that that's what happened. However, there's something else. Andes virus is the exception among hantaviruses in that it can also be transmitted person to person. And so in this case, it's possible that the other passengers of the cruise ship contracted the virus through human-to-human transmission because of that close contact on the cruise ship, and at least 5 strains of the virus from this outbreak have been sequenced, and they've been shown to be virtually identical, about 2 base pairs different, which suggests a common source. All right, so some of you guys might be feeling a little bit warm on your forehead. I know the last kid's birthday party I went to, somebody coughed and everybody was like, "Do you have hantavirus?" And of course, the diseases in the Americas can get very serious. Clinical symptoms, that geographic location, that rodent exposure is really the only thing to increase that provider suspicion. But there are some diagnostic assays. For example, there are some public health labs, reference labs in the CDC that can do a serology to look for antibodies against hantavirus in the patient's serum. In the presence of IgM, rising IgG titers can indicate an acute infection. There's another assay too. You can do reverse transcription, PCR, to look for the viral nucleic acids directly on whole blood or serum, and we're really looking for that negative sense viral RNA. The treatment is really intense support, especially managing fluids, managing oxygen to prevent the patient from going into shock. There have been some investigations into broad spectrum antivirals like ribavirin, but the jury's still out on exactly how much they're really contributing to improvement in patient outcomes. So, is there a vaccine available? Not really. There isn't one in the US. There is actually one in Korea, but it tends to be limited to certain high-risk individuals as well as some military members, but we don't really know if it covers any of the other species. What's the risk to the public? Do we need to worry about a widespread pandemic? And the short answer to that is no. This virus is already endemic in many parts of the world, but the risk of acquiring this infection is very, very low. The number of cases are relatively low compared to other viruses that we see. It's just not that transmissible, especially compared to things like SARS-CoV-2 and influenza. You really need that rodent exposure. even Andes virus that can be transmitted person to person, you really need prolonged human contact. So prevention here is really our best strategy, avoiding areas that have been contaminated with rodent secretions. And if you have to clean out your garage with mouse droppings, make sure you wear protective equipment like respirators and gloves. And with that, I'd like to wrap up here by saying if you are interested in learning more about viruses, please take a look at my illustrated guide to clinical and diagnostic virology. It's available from Amazon. And with that, thank you.